Thank you so much. This is Congressman Adriano Espaillat. I want to thank and welcome all of you to this important meeting, a virtual meeting that we're having with Congresswoman Carmen de la Rosa, with Marisol Rosales, and Diana Hernández, who will give us insight and will give us valuable information for our families throughout the 13th Congressional District and the city regarding the COVID-19 pandemic. I am the Congressman representing the Village of Harlem, East Harlem, Hamilton Heights, Washington Heights, Inwood, Marble Hill, and the Northwest Bronx. And I'm happy to tell you that yesterday, finally, we were able to open a test site on 177th Street and Amsterdam Avenue, as well as another test site on the Sydenham Clinic on West 118th Street between St. Nicholas Avenue and Frederick Douglass Boulevard. These sites will assist our neighborhoods in addition to the existing sites that we have at Metropolitan Hospital on 2nd Avenue and 97th Street, as well as the original site opened nearly 3 weeks ago, right on Lehman College, on Bedford Park Avenue in Lehman College, and the Northwest Bronx Hospital, North Central, right across Montefiore Hospital. You will be able to access testing there. And it's important that we all push for testing, testing, testing. That's the only way that we're going to be able to progress, to be able to determine who's positive, who's not positive, who needs to isolate themselves, who needs to go out there. If eventually we get to test to see who has overcome the illness and has the protection that they need to have to be able to go out there and not get infected again and not infect others. So this is an important conversation about safety for our families. Some of those testing sites, you can walk to them. The original one on Bedford Park was a drive-through testing site. Well, now you can literally walk to your community and get tested. You and your family must be referred by your doctor for you to go get the testing. And it's important that you do so that you don't put yourself at risk as well walking there, and to ensure that you get the appropriate treatment once you get there. So this is an important time for our city and our country. We must come together, and we do that by staying apart, by keeping a distance. We come together by keeping a distance and staying apart. That's so important to have social distancing. And for those of you that can, to stay home. Most of you should stay home unless you have an essential job. You're a police officer, a firefighter, a nurse, a doctor, a healthcare worker. If you work in a supermarket, in a grocery store, or in a pharmacy, then we know you must come to work. But others should really stay home with their families, protect themselves, their families, and their neighbors. We're going to be able to overcome this pandemic by staying in social distancing, by adhering to the rules that have been given to us by the healthcare professionals, and by ensuring that we test ourselves whenever we can, when we have to, when we are referred by a physician, and then we're able to move forward as a society. We'll be able to open up the city and the state once we've done massive testing across the city of New York, and it's so important to do so. Gracias a todos ustedes por estar con nosotros. Yo soy el congresista Adriano Espaillat. Quiero invitarle a este programa donde contamos con la presencia de nuestra asambleísta Carmen de la Rosa. También tenemos aquí a Diana Hernández y a Marisol Rosales, que están con nosotros y nos van a dar importante información. Diana Hernández es una doctora, una profesora también en la Universidad de Columbia, y naturalmente Marisol Rosales es la ejecutiva, la superintendente ejecutiva por el condado de Manhattan, por el Departamento de Educación. Le damos la bienvenida a ellas dos también a este programa. Como dije anteriormente, estamos luchando para asegurar que todas las comunidades reciban las pruebas. Es importante eventualmente contar con pruebas masivas a través de la ciudad antes de abrir la economía, antes de abrir la ciudad. Es importante saber quién es positivo para que se puedan aislar, y es importante también que los médicos puedan referir a los pacientes a estos sitios de pruebas, los cuales están en la 177 y Amsterdam, en Sydenham Clinic, que está en la 118 entre San Nicolás y la avenida paralela a San Nicolás, que es Frederick Douglass Boulevard. También están en Harlem Hospital, también en el Bronx. Contamos con dos de ellos al cruzar del Montefiore, y también en Bedford Park al cruzar del Lehman College. Estos son los sitios de donde se llevan a cabo las pruebas, pero es importante regirnos por las recomendaciones que nos dan los trabajadores y los profesionales de la salud, asegurando que mantenemos la distancia, que nos quedamos en las casas, solo las personas que tienen empleos esenciales como los policías, las enfermeras, los bomberos, los médicos, los trabajadores de salud, las personas que trabajan en los supermercados, en las bodegas, también esas personas que trabajan en la farmacia, son trabajos esenciales, y entendemos que esa gente tiene que salir afuera, pero el resto realmente se deben de quedar en sus casas, en cuarentena, para asegurar que se protejan ellos, sus familias y sus vecinos. Estas son prácticas muy importantes que debemos de seguir para poder derrotar esta pandemia que azota a la ciudad de Nueva York y al mundo. Es importante también que naturalmente ustedes sigan las instrucciones de los profesionales de la salud. Con referencia a Washington, quiero informarle que precisamente el jueves volveremos a Washington a votar sobre el proyecto de estímulos 3.5, que incluirá fondos para los hospitales, incluirá fondos para más pruebas masivas, naturalmente, también recursos para los pequeños negocios, más dinero para investigar por una cura para el COVID-19. Y estos son fondos muy importantes para nuestra comunidad, asegurar de que podemos combatir esta epidemia, esta pandemia. Just want to share with you that I will be heading back to Washington this Thursday to review the 3.5 stimulus package that will have funding in it for hospitals, particularly for hospitals in hot zones. It will have funding, additional funding for testing, for massive testing across the country, and particularly in the city of New York. It would also have funding, specific funding, $65 billion through credit unions and community-based banks for small businesses. We know that the original attempt failed to provide those resources to our small businesses, and we have every intent to make sure that those dollars go to the mainstream businesses that provide most of the jobs for our communities, the mom and pop stores, the bodegas, the pharmacies, the hair salons, those businesses that need a helping hand to continue to move forward and to provide jobs for our community. Por eso ahora me toca la oportunidad de presentar a nuestra asambleísta. Now I take the opportunity to present my Assemblywoman representing the 72nd Assembly District, Carmen de la Rosa.
Thank you, Congressman. And I want to also thank our distinguished panelists who are here. There's a lot to update our community, and we want to take this special moment to thank MNN, Manhattan Neighborhood Networks, and their El Barrio Firehouse Community Center for facilitating this conversation and making sure that our community is informed. Keeping our community informed is part, in my opinion, of what the nature of our jobs is as elected official, in addition to advocating, obviously, for the tremendous needs in our community. It's been a tough few weeks. We've seen so much loss in our communities. We've seen so much disaster, so much tragedy, and we're all coping. We're all unified to deal with these issues. As you heard today, we have now in New York State about 250,000 cases of COVID, with about 14,000 plus deaths. And unfortunately, as the numbers begin to stabilize, we begin to ask ourselves, how did we get to this situation in the first place? Today, we want to take a moment to have that conversation here. We're going to talk with Dr. Diana Hernández, who is an associate professor at Columbia University, and she's going to talk a little bit about those disparities that have already existed in housing, as well as Marisol Rosales, who is the superintendent in Manhattan. I think that housing and education and quality of life, they're all linked in our communities. And so it's important for us today to be here and to be able to add our voices of information for our community. Before we get into the panelists, I just want to give a few updates as to what the state is doing. So as you all heard last week, New York State remains on pause until at least May 15th. The Governor Cuomo, emitted an executive order that requires for everyone to wear face masks when they go outside. In addition, I want to make sure that we acknowledge and we thank Somos Community Care Network, who has opened a testing site in Washington Heights, as the Congressman mentioned. And that site is actually a walk-to site. You can walk there, but you have to have an appointment. And the number for that site is 888-364-3065, and it's open Monday through Friday. So we hope that our community, as the Congressman said, keeps getting tested. If you have symptoms of COVID or have been exposed to someone who is unfortunately deceased or battling through COVID, you should get tested. We are also pushing our state to continue to work on antibody testing. We also know that this is going to be a great tool in the fight against this disease. And I wanted to update folks a little bit about what's happening in Albany as far as legislation. As you all know, we are now on recess, and we are waiting to be called back to Albany at the call of the Speaker of the Assembly. We're hoping to return and just waiting to see if that actually occurs. On my plate, I have as a priority issues that deal with tenants. We know that one of the main issues that our communities have been asking about is the possibility for a rent freeze or a rent cancellation. I stand firmly in support of that legislation, as well as legislation that looks to NYCHA to help tenants of New York City Housing Authority and public housing. In addition to that, I'm working with a coalition of immigrant-led coalition of advocates to work to bring a bailout for undocumented workers who have been left out of many of the stimuluses package that have come forth. And there will be more information on that. And in addition to that, there is legislation that is pending right now on the state level, which I support, to help our small businesses with having pandemics included in their interruption insurance. And so I'm eager to go back to Albany, but in the meantime, my office is here to help. We have a remote line that is available to constituents through a Google phone that my office is manning Monday through Friday. We are helping folks in our district with unemployment insurance claims, access to food, and other benefits. So we are here to help, and we're excited to engage in this conversation. En español, soy su asambleísta, Carmen de la Rosa. Para mí es un placer estar aquí. Le doy la gracia al congresista Espaillat, igual aquí a la doctora Diana Hernández y a la señora Marisol Rosales por acompañarnos. Le damos un agradecimiento especial a Manhattan Neighborhood Network, el canal que está haciendo esta plataforma disponible para nosotros esta noche. Es importante de que en este tiempo de crisis nuestra comunidad esté unida, pero también estemos preparadas para abogar por las personas que más necesitan en estos momentos. Sabemos que de los casos en el estado de Nueva York, hay casi 200,050 casos en el estado de Nueva York que son positivos del COVID y han visto ya más de 14,000 muertes. Muchos de nosotros hemos perdido seres queridos, personas de nuestras comunidades, personas de nuestros trabajos, y nosotros nos sentimos esa pérdida que existe en nuestra comunidad. Estamos aquí para asistir y dar acceso a la información. Yo creo de que es importante que toda la comunidad sepa que Nueva York está en pausa hasta por lo menos el 15 de mayo. Significa que los negocios que no son esenciales y las personas que no deben de salir a la calle deben de permanecer en sus hogares, igual que las escuelas que van a permanecer cerradas hasta el futuro. Nosotros sabemos que el gobernador Cuomo también emitió una orden ejecutiva para que las personas que salieran a la calle porque tienen que salir a buscar comida o medicina o ir al trabajo deben de usar una máscara para cubrir sus caras. También quiero hablar sobre la necesidad de abrir los exámenes de anticuerpos. Nosotros estamos peleando fuertemente para que ese examen se haga disponible en nuestra comunidad, al igual que los exámenes y las pruebas del COVID-19 en nuestra comunidad. Ayer pudimos celebrar la apertura de un centro de pruebas en Washington Heights, que queda en la 176 y Amsterdam, y ese centro está abierto de lunes a viernes. Necesita una cita para hacerse la prueba, pero el número para obtener una cita es 888-364-3065. Así que por favor, si usted ha sido expuesto al COVID o tiene un familiar que desafortunadamente falleció, hágase la prueba, es importante para que la comunidad no siga contagiándose. Un informe breve de lo que está pasando en Albany. Nosotros todavía estamos en receso hasta que el vocero de la Asamblea nos llame a legislar. Estamos preparados y ansiosos de retornar a Albany a hacer el trabajo para nuestras comunidades. Uno de los paquetes de ley que muchas personas preguntan es sobre las rentas y la cancelación de la renta. Yo apoyo ese proyecto de ley. Estamos esperando de que se pueda votar para traer un alivio a los inquilinos. También estoy trabajando con una coalición de inmigrantes para traer una ley que va a proteger a los trabajadores indocumentados en el estado de Nueva York. Y también apoyo una ley que mi colega de Brooklyn introdució para los pequeños negociantes, para que el seguro de interrupción de su negocio pueda cubrir pandemias como el COVID-19. Entonces, ahora quiero presentar a nuestra panelista, la doctora Diana Hernández, y lo voy a decir en inglés. So I am now proud to introduce our first panelist. Dr. Diana Hernández is an assistant professor of social medical sciences at Columbia University at the Millman School of Public Health. She's also the director of community engagement core of the NIEHS funded Center for Environmental Health in Northern Manhattan, and the Director of Community Outreach and Transitional Core of Columbia Children's Center for Environmental Health. Dr. Hernández conducts research at the intersection of energy, equity, and housing and health. She's a sociologist by training, and her work focuses on the social and environmental determinants of health and examines the impact of policy and place-based interventions on the health and well-being of socially economic and disadvantaged populations. So I think that was a mouthful, Dr. Hernández, but we are so proud to have you here. I know that one of the things that our community has been talking about is, how did we get here? How did we get to this place where communities of color are once again disadvantaged and at the dire end of this pandemic? How is it that when we say that 61% of the deaths in New York City are Black and Latinos, what are the factors that led us there? We know that poverty is a risk that we all assume has led to a lot of the deaths in our community. How did we get here, and what are the solutions towards the future? With that, Dr. Hernández, thank you so much for being here.
So thank you very much for the invitation. It's really an honor and a privilege to have this opportunity. I'd like to thank you, Carmen de la Rosa, and also Adriano Espaillat for all of your leadership and your work over the years. It's been incredibly important to have your representation in our communities. So I like to say that the conditions that we're seeing now with respect to COVID have everything to do with the conditions that preceded it, meaning that it was circumstances before this pandemic that made people more susceptible, not just to infection, but also to having more severe consequences, including death. So as you stated, Assemblywoman de la Rosa, we definitely in our communities, and by that I mean Black and Brown communities, by that I mean Uptown, Northern Manhattan, the South Bronx, parts of Brooklyn and Queens, that map onto where immigrants are living, where people of low economic means are living, where because we live in segregated cities, people are essentially more disadvantaged on these levels in these communities. But I wanted to just share the reality about health in these communities and why those conditions end up also not just exposing some of the challenges, but also exacerbating or making worse the challenges around COVID. I actually live and grew up in the South Bronx, and a big part of my work has been about exposing health disparities here and in communities that are like it. And I consider Washington Heights, Harlem, Inwood to also be kind of in step with it. But you have some of the highest unemployment rates in our communities. You have some of the highest poverty rates, the most rent burden, meaning that people are having trouble paying their rent. And at the same time, you have some of the highest uninsured populations, meaning that people don't actually have a way of seeking care by virtue of having insurance. There are many more avoidable hospitalizations, many of them for chronic health conditions like asthma. Also, many people in this community lack a regular healthcare provider, so they don't necessarily have a regular doctor that they're connected with. And then on the health status side, you have some of the highest smoking rates, highest obesity, diabetes, and hypertension, and other indicators of suppressed immune systems, as well as overwhelmed medical facilities. So on the health side and on those kind of social indicators, you have a profile of vulnerability and some challenges that would ultimately land not just again in people being infected, but whereas some folks that are healthier and have more options are able to kind of address this with milder symptoms. For people in our communities, they're more likely to have a harder time. From a housing perspective, you also have housing conditions that have affected health. And then there have been recent studies about air pollution and how air pollution contributes, there's an overlap between air pollution and more kind of higher death rates that are related to COVID. So that's the answer to the how did we get here. And I'm going to attempt to do that in Spanish. I'm going to say that I'm New Rican, third generation. And so me defiendo en español, pero me siento más cómoda hablando en inglés. So, quería dar las gracias a la asambleísta de la Rosa y también a Adriano Espaillat por su liderazgo en todo esto y también para la comunidad en general. También a MNN por hacer esta plataforma para nosotros hablar y platicar de esto. La asambleísta me preguntó cómo llegamos aquí, cómo llegamos a esta situación donde en nuestras comunidades, a donde viven los latinos y también otra gente de color, la gente con bajos ingresos, cómo aquí. Y la realidad en lo que estamos en la situación en cual nos encontramos tiene mucho que ver con las condiciones anteriores. Por ejemplo, los niveles del desempleo, también los niveles de la pobreza son muy altas y la gente tiene bajos ingresos. Y eso tiene mucho que ver con la salud, por ejemplo. En el Bronx y también en comunidades en Alto Manhattan, hay muchas, la gente va al hospital por razones que tienen mucho que ver, por ejemplo, con la asma. Y son, en español, no sé decir avoidable, pero
que podemos prevenir.
Exacto, que podemos prevenir. Y también mucha gente no tienen seguro de salud Además, no tienen un doctor regular donde van a adquirir los servicios de salud. Esas condiciones, hay las condiciones de la pobreza, hay las condiciones de la calidad de servicios de salud y también hay salud. Y en nuestras comunidades hay, la gente fuma más, también la obesidad, la diabetes, la presión alta, y otras condiciones de la inmunidad también bajas tienen mucho que ver con esto. Y hay unos estudios que han encontrado que, que en las comunidades donde hay air pollution, contaminación ambiental, también hay más altas no tanto infecciones, pero también la gente se muere, hay más alta mortalidad. Y también las condiciones de vivienda tienen mucho que ver, ¿no? Que en las condiciones de vivienda que afectan la salud, entonces es como un ciclo que se hace difícil salir de ella. Esas son las razones por las cuales estamos aquí. Yo pienso que ahora vamos a hablar de las soluciones. Y voy a hablar en inglés, entonces hacerlo en español de nuevo. So back to English. So what are some of the solutions? And I have to give credit to both the Congressman Espaillat and to the Assemblywoman for talking about the importance of testing. One of the things that I think a lot about is the parallel between COVID and the HIV epidemic, and really the global pandemic that is HIV. And in some of the earliest work around HIV, we know that there is a continuum of care. And that continuum of care starts with seeking, then with testing, then treating and retaining in treatment. Now, the seek, test, treat, and retain model doesn't necessarily fully apply to COVID because the treatment a lot of times is just resting and staying at home, but doing so in isolation. And we don't know enough about the circumstances around COVID to really, we don't have any kind of real treatments available. So that piece of it is a bit limited. However, the testing piece is important and it's critical for people to be able to know more about their own status, but also when we're thinking about multi-generational housing where people are living with their mothers, their grandmothers, their aunts, their uncles, there are children in the household and there are elderly in the household. It's really important to think about how do we protect vulnerable populations within households, not just in the communities. And a lot of the discussion has been under the assumption that people can safely isolate, but that's not necessarily true when people are living in more crowded housing conditions because of the affordability challenges, right? You have the majority of people that are living in New York City are rent burdened, meaning that they spend more than 50% of their household income on housing. And that naturally means that people are living doubled and tripled up. And we know this to be absolutely true in Northern Manhattan and in places like the Bronx. So absolutely essential to think about opening up testing sites, not just based on whether or not someone works in a particular sector. That's important. We knew that to be important for healthcare sectors and also for, let's say, other frontline workers like police officers. But we also need that to be embedded in communities that we know are higher risk as well, because a place-based targeted testing strategy also allows us to be able to take more preventive measures in protection of our communities. In addition to that, there's another solution which is about social protections. That could be, it should be the range of services from addressing rent issues for people that are having issues paying their rent. Also providing food services, disconnection moratoriums for water, for utilities, enabling Wi-Fi capacity in our communities. This basket of goods that we now rely on because home is so much more important also needs to be dealt with and protected through policy. And also income. So obviously, you know, we need opportunities for people to be able to like easily connect to unemployment insurance and small business opportunities and protections. I really like the idea of ensuring ensuring that the pandemics are covered with small business insurance. And I think the other piece, and I like to always think of my community as being very resilient and resourceful. So a lot of times we talk about the problems, but that's balanced by the fact that so many of us know how to get through hard times. And that's unfortunate because, you know, some of those conditions that put us in hard times are beyond our control. And yet there's so much to be learned about it. And I'd like to give us credit for that. And I think this is really an opportunity to like reimagine a future. How do we go from the circumstances that made our communities more vulnerable to thinking about the circumstances that can really strengthen our communities? And I think that's about creating collective voices and allowing people to really see themselves as core to the work, core to our community, core to our society. And so the kind of imagination and really relying on people to do their thing and bring the power that they have within them to the fore is important. And one last thing that I'd like to say is the idea of equity in all policies. A lot of times, you know, one of the things that we have done very well in public health is to push the idea of health in all policies, so that planners are thinking about health, so that people that are working in housing are thinking about health and education, etc. Right? So you have multiple sectors all really centered on imagining and also planning around the health impacts and trying to address health from wherever they stand. And I think that this is an important opportunity to be thinking about equity and how do we move forward so that communities of color are not always the ones that are dying first and dying the most, because that is an injustice that we can't really support. So I'm going to try to say all of that in Spanish. So ahora vamos voy a hablar de las soluciones y cuáles son las soluciones que yo pienso que son importantes. Y yo voy I'll echo, I don't know how to say that word in Spanish, but voy a seguir lo que dijo el congresista Espaillat y también la asambleísta, en decir que las pruebas masivas son muy importantes. No podemos seguir, no podemos abrir la economía y tampoco no podemos protegernos a nosotros mismos y también a nuestra familia si no tenemos los equipos para hacer las pruebas. Y las pruebas también no solo pueden ser para la gente que están trabajando en ciertos trabajos, como la gente que están trabajando en el hospital, que definitivamente necesitan las pruebas, y también, por ejemplo, la policía. Pero sino que mucha gente en nuestra comunidad también todavía están trabajando, y también el impacto en nuestra comunidad es muy grande. Entonces, tenemos que pensar en hacer las pruebas más a nivel de la comunidad, porque mucha gente vive con su abuela, viven con su tía, viven en hogares que tienen niños y también gente que pueden ser vulnerable, bla, 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 sorry. Y entonces, tenemos que hacer las pruebas masivas para eso. También protecciones sociales, ¿no? Ahorita en todo esto se hace muy obvio que la vivienda, una vivienda sana y que uno puede depender de ella, también los servicios de luz y gas y también de las telefónicas y también el internet son tan importantes. La agua, los servicios de agua que provee a la ciudad y también de comida. Tenemos que imaginar unos servicios más complejos de los que están ahorita pasando y tenemos que entender que la gente necesita un poquito más y un apoyo que sea más robustos y también hacer el proceso de hacer las aplicaciones para el desempleo y eso más fácil y también los ingresos que tienen que subir porque la gente es muy difícil vivir en condiciones de bajos ingresos y entonces tenemos que pensar eso y entonces voy a dejar mi último punto es que en nuestras comunidades nosotros tenemos muchos recursos y también un espíritu y una resistencia a las condiciones malas y difíciles. Y entonces nosotros tenemos que ahora mismito es el tiempo de demostrar eso, de poner lo que es bueno y totalmente creativo y eso por delante para que nuestras comunidades puedan sobrevivir esto y también ser mejores en los meses y años que vienen. Y con eso voy a dejar de hablar. Pero si tienen preguntas o lo que sea, very honored to answer any questions.
Gracias a la doctora Hernández por esta presentación y a nuestra asambleísta. Dos datos antes de escuchar de Marisol Morales. Primero es los negocios que quieran aplicar para la oferta del Hospital Presbiteriano, de darle ayuda económica a negocios de Hamilton Heights, Washington Heights, Inwood y Marble Hill. Pueden llamar al 212-663-3900 o pueden ir a la página de la Federación Hispana, de Hispanic Federation. También, si quieren información sobre los beneficios de desempleo, que son realmente el tema más importante que se ha tratado tanto en mi oficina como en la asambleísta, de 684 casos que hemos tratado en este último mes, la gran mayoría son temas, personas que quieren llenar la aplicación para los beneficios de desempleo, que son $600 a nivel federal por semana y $500 a nivel estatal por semana, o sea, $1,100 por semana. También queríamos dejarles saber y finalizar antes de escuchar a la señora Marisol, antes de su intervención de Marisol Rosales, de que es importante, como dijo la doctora, que si la persona es positiva, que realmente no retorne a su hogar a infectar sus otros familiares. Muchas veces en apartamentos muy pequeños, con 4, 6, hasta 8 personas, algunas veces está la abuelita ahí, la madre, con algunas condiciones de salud que la ponen en peligro. Y realmente hay ya habitaciones de hoteles en la parte sur de Manhattan, donde las personas que son positivas pueden quedarse en cuarentena por 14 días y pueden entonces proteger a sus familias y a ellos mismos y a sus vecinos. Así que le exhortamos a todos que cuando reciban la prueba, si son positivos, que le pregunten a su proveedor de salud dónde deben de llamar para entonces que se puedan ubicar en los hoteles que se han asignado en Manhattan para que esas personas duren sus 14 días de cuarentena ahí protegiendo a sus familias, retornan a su familia y por más información que reciban y por más cuidado que tengan, naturalmente van a correr el riesgo de también infectar a su familia. Y eso es lo que estamos viendo actualmente. Por eso se está propagando también la pandemia, porque personas muchas veces que ni siquiera síntomas tienen o muy leve, retornan a su hogar. Así que con eso vamos a tomar, let's welcome. And what I say basically in a summary was if you need unemployment benefit information, call our number at 212-663-3900. And if you need information about the grant given by New York Presbyterian Hospital in Hamilton Heights, Washington Heights, Inwood, and Marble Hill for small businesses, you can call that number or you can go directly to the Hispanic Federation page and get the application right there and fill it out. Ahora vamos a escuchar, now we're going to hear from Marisol Rosales, who is the Executive Superintendent for Manhattan for the Department of Education. And I know that many of you with your children at home, and I know that many of you are going through a new experience having to have your children do their schoolwork online, that she will have valuable information for all of us. Ella nos va a dar información sobre el proceso de la educación. Welcome, Marisol.
Muchísimas gracias. Mi nombre es Marisol Rosales, soy la superintendente ejecutiva de Manhattan. Estoy a cargo de los distritos 1, 2, 3, 4, 5 y 6, incluyendo las escuelas secundarias. Soy responsable y privilegiada de servir a 116,000 estudiantes y sus familias. La salud y el bienestar de nuestros estudiantes es la prioridad ahora que entramos en aprendizaje a distancia. I want to thank Congressman Adriano Espaillat and New York State Assembly Member Carmen de la Rosa, una heroína para mí, for hosting this virtual discussion. It is a pleasure to be here with you, in addition to you, Assistant Professor at Columbia University, Diana Hernández, and everyone joining us this evening, right? What I think about remote learning in this pandemic, what comes to mind is how important it is to stay connected. That is critical. And as I share information tonight and resources regarding remote learning across Manhattan, I also hope to get your feedback and hear from our families. I just want to say, and I want to start by saying that as an educator who has been a member of the Department of Education for 27 years, as a mother of 2, Latina, and in this new role, I cannot be prouder of our collective effort to ensure the safety and well-being of our children, while we continue to provide high-quality learning in this new reality. Our educators, food service employees, janitorial staff, nurses, students, and families are our true heroes during this difficult time. Principals, superintendents, parent leaders, families, elected officials, community-based organizations, and all over New York City residents have come together in the most incredible way. Leadership, courage, commitment, resilience are few of the attributes that come to mind when I think of all of us in times of uncertainty, in times of loss, in times of fear. We continue to show up as true New Yorkers. We are inclusive and supportive of one another. So for me, there is hope and an opportunity that when we come out of this, and we will come out of this, I promise you that we will come out of this, we will be better and kinder. And so for that, I'm really grateful. I want to share a few updates and then certainly so willing to take some of your questions and your feedback. But as it relates to crisis response, I wanted to share with everybody that we launched regional enrichment centers. And I want to express my gratitude to the staff and the site supervisors at our regional enrichment centers across Manhattan. So that you know, there are 57 centers across the city, and here in Manhattan, we host 10 of them. These sites serve children of essential workers and first responders so that they can continue to provide the vital support New Yorkers need during this pandemic. Our regional centers are open from 7:30 to 6 p.m. En español, les quiero comunicar que nosotros hemos embarcado los centros regionales de enriquecimiento. Y quiero darle las gracias a toda la gente y los maestros y directores que están trabajando en estos centros. Hay 57 centros en la ciudad de Nueva York y tenemos 10 en Manhattan. Estos centros sirven a los niños de trabajadores esenciales para que ellos puedan seguir trabajando con el trabajo tan crítico que tienen en estos días. Los centros están abiertos de 7:30 de la mañana a 6 de la noche. I also want to share an update as it relates to health and wellness. The Department of Education is serving 3 free meals a day at meal hubs across the city to all New Yorkers. There are 400 meal hubs across the city, and here in Manhattan, we have 74 of them. I want you to know that families can pick up breakfast, lunch, and dinner at once. There's no registration, there's no identification needed. The hubs are open from 7:30 in the morning until 1:30 p.m. I want you to know, and so pleased to know that last week we served approximately 1.5 million meals. Families can learn the location at the nearest meal hub by texting food or comida. And I want you to know that I have like some cheating notes. So like I want you to see it here so that you know how to access our free meals. So if you go to the New York City website, you just enter free meals and it will give you the information. You can call 311 and get the information there, or you can text 877-877 New York City Food or New York City Comida. Tenemos centros de comida, hay 400 en la ciudad, tenemos 74 en Manhattan. Familias pueden recoger el desayuno, el almuerzo y la cena a la misma vez. No se necesita identificación o registración. Los centros de comida están abiertos desde las 7:30 de la mañana hasta las 1:30 de la tarde. Aquí está la información, si la pueden ver. The other thing that I wanted to share a little bit is about remote learning. And I once again, I just want to share my gratitude towards our teachers. Their energy and creativity as we embark on remote learning have been remarkable. The priority of us is the safety and well-being of our children while making sure that students receive high quality learning. I want to thank you, all families, for your patience and for learning with us. Right, this is new learning. This is our new reality, and I just want to thank you for navigating this with us and for partnering with us in such thoughtful, caring ways. I want to thank our superintendents, our principals, our central staff, our CEC, and our councils who are helping us support families across Manhattan to have access to devices and that they're equipped to support their children, your children. And so I want you to know that here in Manhattan, through our Manhattan Borough Citywide office, which is the office that I see, we have about 140 staff members who support our superintendents in their teams and our principals. We have 230 schools across Manhattan. And the work and the steps that we have taken is we're working to ensure that students have access to those electronic devices. We are working with teachers and families and everybody to help them with these online tools. We are norming practices for remote learning to ensure that the content is aligned to state standards, right? It is new learning, and so we want to make sure that the tasks and the learning is aligned to standards. We're also partnering with Central to mobilize supports for family, and we are now working on providing social and emotional support for students who are experiencing challenges and trauma. Um, Families received guidance from their schools about how to access remote learning, and can find more resources online at schoolsnewyorkcity.gov, Learn at Home. And that would be this one right here. The Department of Education has also created student accounts for every student, and these accounts allowed for access to Google Drive, Google Classroom, and Microsoft Teams. At the Manhattan Borough Office, we have created structures to support teachers based on their strengths to ensure that they are well versed. Our students with special education, we are now thinking long term, as we know that we will be here for the remainder of the school year. Our students with IEPs are at the central of our planning for this remote learning, and we have made arrangements to deliver special education programs and related services through remote learning. Schools have been in contact with families, making arrangements, and we're giving a template for creating specific remote learning plans for special education students. The Division of Multilingual Learners at Central is developing guidance as to how to enhance instruction for our multilingual learners in different settings, right? We know that it needs to include bilingual classroom, integrated ENL, and standalone ENL to remote learning. And I'm sharing all this information with you, but I just want you to know that if you just reach out to me directly, this is me, and this is my email account, and you can reach out to me, and I can put you in contact with any of our directors in Manhattan, whether it's for supports regarding special education or multilingual learners, as well as support with electronic devices. I can put you in contact with anybody immediately. And the last update I want to share is about device distribution. We have we deliver approximately 175 school-based devices that were distributed by schools. As of this Friday, we distributed more than 110,000 iPads, and we will. Not only have we prioritized delivery to students who live in shelters and temporary housing, but we're also prioritizing delivery for students with IEPs and our multilingual learners. We will have all 240,000 iPads delivered by the end of the month. So, en español, la distribución de dispositivos electrónicos. Inicialmente las escuelas entregaron 175,000 dispositivos electrónicos y hacia el viernes que pasó, nosotros entregamos 110,000 iPads, y la meta de nosotros es que para a fin de mes entreguemos 240,000 dispositivos electrónicos. Esta es mi dirección, aquí me pueden encontrar, y tenía otro por aquí, justamente aquí. si necesitan, y aquí es donde yo necesito ayuda, si necesitan un dispositivo o si hay familia que ustedes conocen que necesita un dispositivo, por favor, llamar al 718-935-5100 y opriman la opción 5. Si no, pueden entrar a la página de inicio del Departamento de Educación, que es esta, y entrar a buscar la encuesta de dispositivos. So I want to stop right there, and if there are any questions that you have for me, any feedback, I'm here to answer.
Executive Superintendent Rosales, gracias. Y ahora vamos a abrir para preguntas. Let's open it up for questions. Any questions coming through?
And we know also that Dr. Hernández has to jump off in about 10 minutes. So if we have any questions for her first, that would be great.
Any
First question that we
questions?
have in Facebook, it says, Congressman, what are you doing to convince Nancy Pelosi to put to the floor the vote for my funding for small businesses, which has run out of funds already? The question comes from a person called Rojo Martin.
That's a very good question. Yes, as we are speaking today, the Senate has approved a $480 billion stimulus 3.5 bill, and we will be going back to Washington tomorrow. Mientras estamos hablando aquí, ya el Congreso precisamente ahora aprobó un tercer estímulo, un paquete de estímulos de el 3.5 de 480 mil millones de dólares. In that stimulus package, we made sure that we included monies for small businesses because we saw how it failed in the last stimulus package. And we saw how in about 2 weeks, the money had dried up and the money had really gone to folks, not in Main Street, but bigger businesses of 400 or 450 people. So we've included $65 billion that will go to credit unions, to community-based financial institutions, local banks in the neighborhood that already have a working relationship with the small mom and pop stores and the small businesses so that they can get access to the Paycheck Protection Program. Le digo que en este proyecto que acaba de aprobar el Senado, que tendríamos nosotros que revisar y aprobar en la Cámara de Representantes el jueves, se ha aprobado también 65 billones de dólares para préstamos perdonables para pequeños negocios. Y este dinero, diferente a la última tajada de fondos que fue asignada, que todos entendemos que no llegó a los pequeños negocios, aseguramos que estos fondos van a ser asignados para cooperativas financieras y bancos comunales en la comunidad que tienen relaciones de trabajo con los pequeños negocios, para que ellos entonces puedan someter y llenar las aplicaciones de estos pequeños negocios, salones de bellezas, bodegas, farmacias que se encuentran en nuestras comunidades y puedan accesar este proyecto de ley que le da el préstamo, y si el comerciante enseña que puede proteger los trabajadores, que puede mantener los trabajadores en su negocio, entonces le perdonan el préstamo. Así que esperamos que esta vez sea más práctico y que llegue a los pequeños negocios. Next question, please.
Stephen Love asks, this crisis demonstrates beyond a shadow of a doubt that we need Medicare for all. Why is Nancy Pelosi pushing a COBRA funding scheme that simply funnels money to private health insurance companies?
Nosotros sabemos, we know that we need health care for all, and we know that we will have to tackle that issue. And this crisis shows us, it unveils to the rest of America what we already knew, the healthcare inequities across the city of New York and across our country. Dr. Hernández clearly stated early how it is that Latino males who until now, or Latinos in general, that make up 34% of the deaths, although we're only 29% of the population, how they are exposed to this virus in a different way, in a deadly way, because they suffer disproportionately from diabetes. They suffer from high blood pressure. I suffer from high blood pressure, and therefore I'm a target for this virus. And that's why you see the Latino and African American men over 50 on a ventilator fighting for their lives because there's healthcare inequalities fueled by pollution, fueled by environmental issues that impact us on a daily basis. And so we already knew that we have been dragging this for a long time. This pandemic has unveiled this to the world, and we must not perpetuate that any longer. This is, if there's a silver lining in this dark cloud, is that we should alleviate and we should resolve once and for all these inequities. And it will take a major transformation in the healthcare system. And yes, I believe in Medicare for all, but we will have to approach it individually. And I think this time we need to take help to the doctors and the nurses and the healthcare institutions, particularly on hot zones. And that's what this bill is doing. We also have to address the issue that was brought up with the last bill, which the funding for small businesses did not get to Main Street. We must ensure that there's more money for testing and for protective gear for our healthcare workers. And I believe I will take a look at the details of this bill. I have not reviewed it yet. It just got passed by the Senate. We will take a look at it tonight and tomorrow before it's voted upon on Thursday. But I am supportive of taking on that debate as quickly as possible. Next question.
Question for Dr. Hernández. How do we help improve quality of life to avoid some of the issues that have led to Latinos and African Americans being the most who suffer from future epidemics/pandemics?
So good question. I mean, I think part of it is ensuring that people have decent housing, ensuring that air pollution isn't necessarily the burden of just some communities, and that, policies like congestion pricing, for instance, that are, coming down the pike don't have the unintended consequence of them polluting some of the outside areas. These are the questions to be asking of the policies that are pending, and also just the standards that we keep for everybody. And that's partly about enforcement. So really enforcing the housing code and ensuring that people know their housing rights, for instance, and that they have access to the information to ensure it. That there's a kind of a intentional enforcement happening around that, and also that people have not just living wages, but are able to really economically thrive and have protections across a number of domains, as I kind of stated before. So part of it is, what I like to say is, a lot of times we think a lot about resilient communities and ensuring that our communities are resilient, but I think what we really should be aiming for are secure communities. Communities that are food secure, that are housing secure, that are economically secure, that don't have to wonder about how they're going to pay their utility bills or their rent or mortgage. And that security is actually what allows people that don't have those problems to be healthier, because they don't have those issues weighing on them, right? They don't have what we call in the academic world an allostatic load, which are all the burdens that people shoulder that end up coming under the skin and affecting people and their kind of chronic health conditions by the stress mechanism, right? So you stress anything too much and eventually it folds. And that's also true for our bodies. And a lot of times that's driven by external factors that really aren't about the kinds of things that are biological. And I want to make sure that before I leave, that I leave with a very clear message. And that message is that there's nothing inherently wrong with people of color. And what puts us at weakened health positions has a lot to do with the social circumstances and the economic circumstances that actually there are policy routes to address, because a lot of times it was policy that created the messes. And so we just have to be careful not to think of this as an endemic issue. Like, it's not necessarily a personal issue, a biological deficiency that people of color have, but instead are the really addressable questions and circumstances that are from the kind of early on. All right, so Marisol's work is about children and ensuring that they have the best life chances, and that naturally materializes into adulthood. So I don't even know where to begin to answer that in Spanish, but I'll just say that para decirlo en español, tenemos que tener un enfoque en seguridad. La seguridad de la nutrición, también de las condiciones de vivienda, de otras cosas que tienen que ver con el sobrevivir. Y no hay nada biológicamente, no tenemos problemas en nuestra comunidad de nuestra biológica, sino son las condiciones económicas y sociales que han creado estas condiciones de salud que se hacen muy difícil, pero se pueden prevenir. Y mucha gente que tienen más privilegio no tienen estos problemas porque tampoco tienen no están acumulando tantas condiciones difíciles. So the story is really about kind of aiming for security, not aiming for resilience, and also allowing people to live healthier lives just by virtue of investing in them, so that we don't have to invest so heavily in the healthcare system, because we're really preventing the kinds of issues that people would be going in for that are much more costly and hurt people even in terms of being able to make a living for themselves.
Okay, next question. La próxima pregunta, por favor.
I do have to jump off because I have another commitment. So I would just want to say thank you to everyone, especially Congressman Espaillat and Assemblywoman de la Rosa. And also, it's been a pleasure to be on a panel with you, Marisol Rosales, as well. Thank you, MNN. I really appreciate this opportunity. Happy to connect also by email and other mechanisms. Thank you.
Thank you, Doctor. And I wanna thank you and express to you our gratitude for the great work that yourself, the nurses, the healthcare workers, that you're all doing in the hospitals and the medical centers across the district and the city and state of New York. You're truly heroes. You leave every day to your jobs to save our lives, and you put your lives in danger. And I just want to stress that we are so proud of the work that our healthcare workers are conducting to save our families in New York City, and New York State, and the world. Thank you so much for being with us. Otra pregunta.
Thank you, Doctor. I also want to extend my gratitude to you. It's empowering to see a Latina leading the charge. And I think that what you spoke about today that really hit home for me is the need for economic, environmental, racial, housing, equality in our and equity in our society. So thank you so much for your thoughts.
Thank you so much. Really a pleasure.
Thank you. Any questions, preguntas?
Pregunta en español. ¿Cómo está el Department of Education manejando la asistencia de los estudiantes? ¿Cómo hacen con las familias que no tienen computadoras o tabletas para ayudar a los niños?
Gracias por esa pregunta. Las escuelas todavía son responsables por implementar mecanismos para ver la asistencia de los estudiantes, pero más que la asistencia de los estudiantes, es para ver cómo ellos están envueltos y están, la palabra se me escapa, that they are engaged in meaningful interactions, que están participando en una manera productiva académicamente. La asistencia no se debe considerar en una manera tradicional, pero la realidad es que necesitamos saber quién de los estudiantes está participando para que no preveamos pérdida de aprendizaje. Nuestras escuelas tienen una plataforma para tomar asistencia y las escuelas son familiares con esa plataforma. Los directores tienen una persona encargada de asegurarse de eso. Lo otro que yo quiero decir que es muy importante es que los estudiantes no van a ser, they won't be penalized for absences. Y nosotros hemos removido asistencia como un factor para el futuro. Nosotros sí tenemos que tomar asistencia porque eso es requerido por la ley. Am, pero no es tanto la asistencia más que la manera en que los estudiantes están participando en la educación de ellos.
Otras preguntas? Any other questions?
Next question. Will this information be made available for French-speaking Africans in the district?
We will try to do that as well. Nosotros trataremos también de proveer esta información en diferentes idiomas. We will try to make it available in different languages across the district. There is Russian speaking in the district. There is also a Senegalese community, obviously, French speaking community. There is a Albanian community in the Bronx, a Vietnamese community in the Bronx, and we'll try to get that information out. Good point. Próxima pregunta.
Since the banks have received 20 trillion in free money from the Federal Reserve since 2018, with more being given every day, what will the Congress do to force the banks to give authentic mortgage forbearance during this crisis, which means taking the forborne months onto the end of the mortgage instead of demanding a balloon payment at the end of the forborne period?
I agree with that. For far too long, we have been bailing out the banks. I think it's now time to bail out Main Street, and the mechanism has to be put in place for small businesses, which are the biggest employers in the country. It is not the big corporations or the big box stores, for that matter, that are the biggest employers. It is the small businesses across America, and particularly in my district. And we must ensure that we protect these businesses, just like Wall Street was bailed out, just like Detroit was bailed out. We must now bail out Main Street and provide not only the dollars that they need to be able to pay backed up rent expenses and continue to keep their payroll moving under very adverse conditions, because I may add that for us to get back to any level of normalcy, it will take massive testing. I think it will be a long time before people will congregate in large numbers. People will feel comfortable going to a restaurant or even to a crowded supermarket. It will be a long time before people feel comfortable going into the subway system or the buses. And so we must test, but also provide a lifeline to small businesses. And I think the banks must play a critical role in this. I think in the last stimulus bill, it was clearly shown that they took advantage of it. We must stop them from doing so, and we must provide this opportunity for small business. I think in the next stimulus bill, we will provide at least $65 billion for them, that I think will go a long way, but we must do more. Next question.
Will there be some type of provision wherein, first, the IRS does not penalize early 401k withdrawal, and second, the IRS refund the 20% automatic tax withholding when withdrawing early? This source of funding is essential for a lot of people.
Well, I am sure that we will discuss as we move forward, perhaps in the following, not this coming stimulus package, but the following one. Matters pertaining to taxes in that realm, 401ks and other financial instruments that are used for people's retirements, for people's well-being after they worked a long, hard life. And I think that we should protect workers. We should protect Americans. We should protect workers. We must ensure that they have a path to their retirement, unimpeded path to their retirement, and we must do whatever we can to reform the IRS laws so that they're people-friendly and not necessarily a big revenue capturing machine to fund some very often programs that may not be needed across America. thank you for that question. That's a good question, and I'll take up your suggestions. Next question.
That's all we have for now, Congressman.
Muchas gracias. I want to thank all of you. Before I give it up to our Assemblywoman, I want to thank Marisol Rosales, who's doing a fantastic job in the Department of Education with our children and our families. Dr. Diana Hernández, who was here with us, a great Latina doctor at Columbia University and New York Presbyterian Hospital. And of course, our Assemblywoman. We are crossing difficult times, unprecedented times, though. But we want to be thankful for those of you that have gone out to protect all of us. We want to be thankful for police officers, firefighters, our nurses and doctors, those healthcare workers, but also the young women and the young men that work at the cashier at the supermarket, the young men and young women and the folks that deliver our food in our doors, the livery cab driver, the taxi driver that puts himself or herself in danger to maybe transport senior citizens for his or her dialysis treatment. We want to be thankful for all those essential workers that are clearly folks that are putting their lives on the lines in the middle of this pandemic to protect our family. We are deeply grateful to you. We really love you and we want the best for you. We will continue to fight for you to make sure that you get the protective equipment that you need to be safe for your families. We want to make sure that you get compensated as you should be compensated, as the heroes that you are. But we also want to help our small businesses. We want to make sure that they stay alive. Very often it is the small businesses that provide the personality, the character of a neighborhood. They represent who we are as a community, and we must preserve them. And we preserve them by throwing them a lifeline, by making sure they get the funding, the resources that they need to continue to make payroll, to continue to make rent, to ensure that they can move forward. We want to take this opportunity to thank also New York Presbyterian Hospital for the $10 million grant they gave local businesses. I think is important that we recognize that. We want to also thank Somos IPA, the group of doctors, community physicians that continue to work on our behalf on the streets of our community, providing testing, ensuring that the voices of our local community doctors and our patients are heard. Dr. Ramon Talach, also Dr. Lantigua, who works for New York Presbyterian. People in Harlem, Lloyd Williams, who heads the Greater Harlem Chamber of Commerce. Sylvia White, who represents Harlem Hospital. In the Bronx, many good people in the Bronx in Montefiore Hospital. Our educator, we want to thank them for taking the opportunity to continue every day to try to teach our children online. A tough job. I know it's a tough job, but we're doing a good job of moving forward together. And the best way we can stay united is by keeping our distance right now. The best way to stay united as a community, as a country, is to keep our distance right now. Queremos darle la gracia a todos ustedes y felicitar a los trabajadores como los policías de emergencia, los bomberos, las enfermeras, los doctores, el personal, trabajadores de salud, pero también esos jóvenes y jóvenes que trabajan en los supermercados, en las cajeras, también las personas que nos hacen los deliveries a la casa de nuestra comida, los taxistas que se arriesgan diariamente llevando a nuestros envejecientes a lo mejor a la clínica para un tratamiento de diálisis. Queremos darle la gracia a todos ustedes. Ustedes son nuestros héroes. También queremos llevarle a ustedes la protección que ustedes merecen para que no sean positivos, para que no se infecten, para que sigan trabajando y luchando a favor de nosotros, y también traerle todos los recursos a las instituciones como los hospitales de este vecindario. Queremos felicitar también a Somos, un grupo de médicos locales que han hecho un excelente trabajo, el doctor Tallá, el doctor Rafael Lantigua de la Universidad de Columbia, también felicitarlo a él. Y decirle a los pequeños negocios que queremos seguir apoyándolo, darle la gracia al Hospital Presbiteriano por los $10 millones que ahora le están llegando a muchos de los pequeños negocios, pero necesitamos nuestros pequeños negocios porque le dan el carácter, la personalidad a nuestra comunidad y son los mayores empleadores. Así que gracias a todos ustedes por estar con nosotros esta tarde, y ahora se lo dejo a nuestra asambleísta Carmen de la Rosa.
Thank you, Congressman, and thank you for being here. I also want to thank Marisol and Dr. Hernandez. I want to echo the sentiment of our congressman in thanking our essential workers, thanking our educators, thanking the healthcare providers in our communities who have stepped up, even those that run clinics. You know, they've been critical in ensuring that our health system did not collapse. I want to also thank all of those workers that are not traditional workers, that people often, you know, don't understand what they mean for our economy. Those workers that have been left out of stimulus packages, those workers that are immigrants that have built our community. In addition to that, I want to say that yes, it's true. The best thing we can do right now is social distance and remain home if we have the privilege to do that. But social distancing doesn't mean that we're emotionally distant. This is a time for our community to remain united, to understand that there is a day where we will oversee this pandemic and look back and reimagine a community that is much stronger and much wiser because of all the injustices that we will be able to uncover due to the obstacles that we've had to go through in this moment. I want to say that in this time of great need, if you're able to check on an elderly neighbor, if you're able to volunteer your time, if you're able to listen, it's the moment to step up and do that. I'm excited to envision our community coming to even closer together. I want to reiterate that mental health and wellness is something that we need to continue to prioritize in our communities. And after this pandemic, it will be even more important for us to make sure that those resources are coming into our community because the loss that we've experienced is not small. I want to reiterate the number for the state hotline for mental health is 1-844-863-9314. If you need help, if you need to talk to someone, there is help available. In addition to that, I want to say that what we often are listening to now, that we see that the inequities are happening in our communities, is that our communities have been left behind. Well, this is a moment, an opportunity for growth, an opportunity for us, as Dr. Hernandez said, to make sure that equity exists in policymaking and in the voices that we can lift in this process. And so I look forward to doing that with the congressman and with our elected officials, but also with community activists who have taken a role and created funds as well for our community to help those most in need. I want to thank MNN for allowing us to this platform, and we look forward to continuing to inform our communities the best way we know how. En español, quiero unirme al agradecimiento de nuestro congresista, a todos los trabajadores esenciales, a todas esas industrias que él mencionó, a los trabajadores que están en la calle a diario y también a esos trabajadores indocumentados que han sido dejados atrás. Es nuestra responsabilidad hablar y abogar por ellos también. Quiero decir que este momento es un momento difícil. Nosotros sabemos que nunca hemos experimentado algo así, pero yo estoy confiada de que nuestra comunidad va a salir de esto mucho más fortalecida. Vamos a ser una comunidad que vamos a entender, abogar por nosotros mismos para que no hagan las disparidades que existen en el sistema de salud, en el sistema educativo, el sistema de vivienda, para que el futuro de nuestra comunidad sea mucho más fuerte. Como dijo la doctora Hernández, como dijo la señora Marisol, este es un momento de imaginar el futuro de nuestra comunidad que está en nuestras manos. Así que le felicito a todos los panelistas que estuvieron aquí y recuérdense que si hay una persona que necesita ayuda, la salud mental es importante en este momento de mucha pérdida. Y el Estado de Nueva York tiene un programa donde usted puede llamar y hablar con un profesional de la salud mental en el 1-844-863-9314. El estigma que existe ahora mismo con la salud mental, tenemos que romper esa barrera porque nuestra comunidad necesita ayuda en este momento. Así que gracias a todos y un agradecimiento especial a MNN.
Bueno, gracias a todos. Muy buenas noches. Gracias y manténganse sintonizado hasta el próximo programa. Thank you all. God bless you and keep the faith. Thank you, MNN.